Good afternoon, everybody. The executive meeting finished just a short time ago, and we have agreed to support the Health Minister in lifting the restrictions on access to graveyards. This is about balancing public health concerns with the basic human need for people to visit their loved one's grave. And in lifting this restriction, it is vital that members of the public heed the advice around going out in public when they are in a cemetery, respecting that 2-metre social distancing rule, limiting their interaction with others, and of course washing their hands thoroughly after they have been in public. Losing a loved one is a huge moment in anyone's life, and whilst homes all across Northern Ireland are having to grieve without a wake or a public funeral, I do want to take an opportunity to sympathise with political colleagues who are currently grieving. My colleague Edwin Poots, who will bury his father shortly, having been involved in caring for Charlie over recent years, I know it has been very difficult for Edwin not to be close to him as he approached the end of his life. And Charlie was elected to this place in 1973 and was a founding member of the Democratic Unionist Party. Sir Geoffrey Donaldson buried his father yesterday. Jim was a big character in the Kingdom of Mourne and someone who served his country with distinction. And I know Jim was incredibly proud of his family and they were so important to him. I also want to sympathise with the family of a former MLA, Oliver McMullen, on the death of his 22-year-old daughter. And those of us with children of that age will immediately think of our own home. Unfortunately, COVID-19 has impacted on our traditional approach to mourning in this part of the world. We have been speaking with funeral directors as many non-COVID-19 related burials still take place. And during the pandemic, it is strongly recommended that funeral arrangements are made with your undertaker by telephone and not in person at the funeral director's premises or the family home. And while funeral notices can still be placed in newspapers or using online services, funeral arrangements should not be advertised. So in order to prevent the spread of COVID-19, wakes should not be held. Funerals should be in private, adhering to social distancing guidance, and only a maximum of 10 people should attend. Current restrictions on social gathering and the need for social distancing means that any gathering such as are common after a funeral should also not take place. And I know, we both know, that a lot is being asked of the bereaved at this time as you grieve. But we would not be asking you to respect these restrictions if it were not quite literally a matter of life and death. So please do listen to the advice of your funeral directors. And to the wider population, as we head into this beautiful weekend, please do remain at home as much as possible. And if you do need to go out for essential work or shopping or exercise, please respect the social distancing advice and wash your hands thoroughly. That's the most effective thing you can do to stop the spread of COVID-19. By following that advice so far, you have made a major contribution to reducing the peak of this pandemic, and we cannot lapse now. We have flattened the curve, but now is not the time to be careless or try to cheat the rules. We're not out of the woods, and trying to make a quick dash for the exit would be a mistake. We are working on a careful plan for recovery. We will be urging people to think about what the new normal looks like in their home or in their work or in their neighbourhood. And social distancing will be with us for a long time if we are going to protect life and indeed our NHS. Rather than placing the whole country into a permanent deep freeze, we will need to learn how to work and go about our business and observe social distancing. In terms of testing, we are entering a new phase. Testing and tracing and tracking is key to all of that, and we discussed this at the Executive and a need to ramp up our capability. And to that end, we are retaining environmental health officers from local government to help increase our capacity. And for this work to be effective, we need to be able to test and trace. That's key to our recovery and renewal. One without the other is not going to be effective. With regard to connectivity, it would of course be a nightmare if the ship stopped running between Northern Ireland and the rest of the UK, and we welcome the government's support package for the shipping industry. We continue to speak to the Chancellor about making our air, road and sea supply routes more resilient. And finally, for those concerned about nursery and school places, the Education Authority has clarified that they will be issuing letters to parents on behalf of schools and playgroups to advise on the outcome of the child's preschool or primary one applications. And letters should be with parents next week on Wednesday, 29th of April. And the Education Authority will also be opening an online portal which will be accessible via their website on that date. Parents and guardians who had applied online in January 2020 can log in and obtain their information in relation to their children. Thank you very much. Michelle.
Thanks, Arlene, and good afternoon, everyone. Can I also start by extending my sympathies to Edwin and to Jeffrey on the loss of their daddies. To lose your daddy at any time is a very difficult time in your life, but to do so in this period now is just, your grief is even more compounded by the difficulties of not being able to have your loved ones around you. Can I also say to Oliver McMullen about the loss of his beautiful wee star, Tierna. Tierna would just light up your day. Anybody that knew her would know that and could say how wonderful a young woman that she was. And, you know, to the McMullen family right now, our hearts are with you. There isn't anybody that couldn't tell you a story about Tierna McMullen from the Glens of Antrim. She just was such a character and she really did light up people's lives. So to the McMullen family today, I just want to say that we're thinking of you and we will see you on the other side of all of this. Today is a very sad day also for many other families, and today we've learned that about the deaths of a further 15 people to COVID-19. We've also learned that between the 10th and the 17th of April, COVID-19 was involved in the deaths of 64 more individuals than had previously been reported for that week. And again, we want to send our sincere sympathies and thoughts to all those people that have lost a loved one at this time. I think that's the reminder to each and every one of us that this virus is deadly and that it is killing people. These individuals are not statistics. They are people who have lost their lives. They are people with families and friends and loved ones, and people who will feel their loss dearly. Those NISRA statistics that were published this morning set out that of the 276 deaths involving COVID-19 up to the 17th of April, 93 of those occurred in care homes. That is more than a third of deaths, and it speaks very clearly to the importance of prioritising our care homes in the response to this pandemic. Making sure that they have all the PPE that they need, and making sure that we have widespread testing and surveillance. I'm also pleased that we have now announced a programme for more widespread testing, and care homes will be a vital component part of that. The expansion of testing and a rigorous programme of tracking and tracing will be hugely important as we continue to respond to this emergency. And be under no illusions, this is still an emergency. The virus is still here and it's not going away anytime soon. So this is not the time to drop our guard. This is not the time for anyone to be complacent. And it's not the time to be talking about an exit strategy. We are still in the middle of the pandemic. The message has not changed. Everyone must stay at home unless they have a clear need to be out of the house. If our behaviour begins to change and the people aren't compliant with the public health measures, then our actions could reverse what's been achieved so far. We can't allow that to happen. We understand wholly how difficult this is for everybody. We're all very mindful of people's mental health at this time, and I am pleased that the Executive has today decided to appoint a mental health champion to work with us as we come through this pandemic. We also recognise that the comfort of visiting the gravesides of a loved one and what that means to so many people. And that's why we had committed to keeping this issue of graveyards under review. We've listened very carefully to the genuine distress of families who have not been able to visit the grave of a loved one. I understand that there's a fine balance in making sure that people do not face additional burden in terms of their mental health and well-being, and also our role in making sure that people are not put at further risk from the transmission of coronavirus. So the opening of graveyards will only be permitted where there are those in charge of burial grounds that they can ensure that we have compliance with the regulations and appropriate social distancing. As with all the regulations which are in place to protect people and save lives, we continue to keep these issues under review. So my message as we go into a weekend where the weather is predicted to be lovely is to please keep doing please follow the public health message. Please don't put any lives in jeopardy. Please keep staying at home, do the right thing, and we can get through this together.
Good afternoon. First of all, Michelle, on Tuesday, closing cemeteries was a price worth paying. How could Sinn Féin have got this so badly wrong? For both of you, does this point the way forward when you come to looking at the recovery period, like relaxing things? Could, for example, garden centres be among the first things that reopen? Do you disagree or agree on that subject? And finally, on care homes, which you've touched upon, given the number of people dying in care homes, will the Executive prioritise this sector when it comes to testing, PPE and staffing?
Well, firstly, Gareth, there's the fine line always to listen to people and understand people's concerns, and genuine concerns were expressed in relation to graveyards. I always said that we would keep these things under review, and we listened very carefully to what people had to say. And you have to get that fine balance between protecting people's livelihoods, people's lives, and also then listening to people whenever they've expressed a concern. So I'm glad that the Executive has found a way forward in relation to being able to allow graveyards to be open, provided that they can social distance and all the proper controls are put in place. That's a good thing. That's us listening to people at this moment in time. That's us understanding the angst that was there. That's us not wanting to exasperate anyone's mental health or families that are grieving right now. So I think that today's move by the Executive is the right move, and I welcome the fact that we have got here. We have said that we have regulations in place. We accept that they're quite draconian measures, and we have said that we will review all of those in advance of the 9th of May, and that remains the Executive position where we look at all of these things. But our number one priority right now is about dealing with the fact that we are still in the midst of the pandemic. It is about trying to save lives, and it's about asking people to please keep doing what you're doing, because we are actually having such a positive impact in being able to bring down the levels of people who will lose their lives.
So Gareth, thank you. In terms of the access to graveyards, the Chief Medical Officer and the Chief Scientific Officer were clear with us this afternoon that it was a proportionate and low risk amendment, and we will listen very carefully, of course, to the public, but also we have to take on board what our scientific advisors are telling us, and we will do that continually throughout this process. We have modelling going on for Northern Ireland in terms of what is happening to the virus. I'm on record as saying that the virus is not going to disappear. We're going to have to live with the virus for quite some time. And because of that, social distancing will be with us for quite some time. But when we're looking at other issues around recovery and renewal, we have to keep all of that in the back of our minds around continuing to suppress the virus and making sure that we take actions which are proportionate and which are measured and which are appropriate at that time. Because public health, and I know there's been some commentary around this week about public health versus economic growth. To me, the two are interlinked because we have to have an economy to go back to. But it is important that public health is always at the forefront of everything that we decide. In terms of care homes, we have been working very hard on those issues. We have been talking to the Minister of Health around that. Of course, we want to see, and as you know, there's a pilot happening now next week, starting on Wednesday, about contact tracing, and the care homes will form part of that. But of course, we do have to prioritise symptomatic patients and our key workers, and we've advanced that key workers so that it's not just health service workers that get tested now, it's a wider group of key workers that get tested. So it is important that we continue to work with the Health Minister and continue to listen to the concerns, not just of care homes, but of people right across Northern Ireland.
Good afternoon. Just on the care homes issue, with the figures that have come out today and the realisation that around a third of deaths are in care homes. The contact tracing, First Minister, that you've just mentioned, is that in response to these figures now and the grasp now that, and the fear that the COVID crisis could create more of a problem within the community rather than in our hospitals? So a question to both of you on that. And then also, albeit you've said there today, and you've repeated it, something you said earlier this week, what the new normal could look like, and albeit we don't want to rush to the exit, is now the time, though, to engage with the public about what the future looks like and how they're going to cope with that, just as Scotland are starting to do. Do you think the public, both of you, do you think the public have a grasp of what the future is going to be like?
Well, I think the public have a grasp that it's going to be a completely different world for a period of time, certainly as we learn to live with this virus. Both Michelle and I had a conversation with Scotland and Wales, and indeed the London Mayor yesterday, around their plans for moving forward. We, of course, would like to see our modelling coming forward in terms of our plans for moving forward, but we have been briefed around the economic impact that this may well have on Northern Ireland, and the fact that every month in lockdown costs 3% of GDP, and that in Northern Ireland terms is about £1.3 billion. So huge figures to be dealt with, and we know that economic well-being and having good health are very much interlinked, and we will bear all of that in mind with our plans. And we do want to engage, and again we have engaged with some of the hardest hit industries, the tourism industries, the retail industries. We're listening very carefully to what they are saying to us, and we had a meeting with them just yesterday. So we will continue to engage on all of these issues, Vicky, but for us today on this stage, the public health message is still very critical in terms of flattening that curve, making sure that we don't see a resurgence of the curve, because that's critical going into this weekend. Your other question, I think, was around the care homes piece, and whilst the virus is, I understand, in 63 of our care homes at present, that's about 14.7% of our care homes. That compares favourably to the rest of the UK, where it's the figure is at 26%, and in the Republic of Ireland it's around 30%. So we're not minimising what's going on in our care homes, far from it, and certainly our testing and tracing is not a reaction to what has happened in care homes, because it's actually a critical part of us planning for the recovery. We need to be able to track and trace the virus throughout our community, so that we know what impact that lifting various restrictions will have on the community, and the only way to do that is to have this community tracing. So it's about having that integrated plan for the future around tracking and tracing the virus, and looking and listening to what our medical and scientific officers are saying to us.
I suppose just to add to that, I mean, you have pointed to the fact that a third of the cases are in our care homes, and we've always been very conscious of the fact that there needs to be a dedicated focus on care homes, and we regularly discuss this as an executive. You know, part of when you look to the experience of other countries who have been, you know, at an advanced stage to us at this point, we're clearly learning those lessons. Part of the World Health Organization's recovery plan, where they set out six areas where you need to focus, and clearly that's around test and trace and isolate. So I welcome the progress that we've made there. But they also point to the fact that you need to have a dedicated focus on areas such as care homes, where you're going to have clusters of people potentially contracting the virus. So we're very, very mindful of all of that, and we will do absolutely everything that's necessary to make sure we support those people in our care homes, those people that work in our care homes, and put a really strong emphasis on this on an ongoing basis. I think that, you know, people talk about this phrase, the new norm, and I've heard some people saying they don't even like that phrase. But life as we know it has changed, and I think the public are very, very alert to everything that's happening, and everybody's following every news outlet and seeking information, and we want to communicate with people as best as we can and give them the fullest information as we can. But for example, the issue of social distancing is going to be a feature of our lives. It's going to be a feature of our lives for perhaps up to a couple of years, if not beyond. And I think, you know, so that's an adjustment in itself, how we actually conduct ourselves in our everyday lives. So I think that as we have information, we will give that information to the public. As we look at the modelling and work our way through it, then there's nothing that we will, you know, hold back on. We'll make sure that everybody has every piece of information that they need to have.
Good afternoon, Arlene and Michelle. Tommy Gorman here. Those new stats you received today from the Stats and Research Agency, they provide a more comprehensive picture in some respects, and they reflect the pattern that we saw last week. And if you look at, say, the number of deaths north of the border and south of the border, and the incidence of the disease north and south of the border, it's almost as if there's an Ireland version of the virus, as if there's a border down the Irish Sea, because the incidence of death seems to be the very same north and south. If that is the case, how do you propose to dovetail and coordinate the emergence north and south of the border from these measures that are in place, these restrictions? Will it be done by health advice, political advice, or a mixture? And the second question, those stats today suggest that people over 75 accounted for 3/4 of coronavirus-related deaths. That means 25%, 1 in 4, are under 75. Have you concerns about that statistic? Thank you.
Okay, well, thanks, Tommy, for your question. There's no doubt that the pandemic is proceeding in a similar way right across this island. There's also, it's very clear that the course of the disease has been different here on this island compared to that what's been experienced in Britain. We talked about this yesterday just with colleagues from Scotland and from Wales and with Sadiq and the Mayor of London. And, you know, I suppose the numbers speak for themselves insofar as our death rate here is probably 50 to 60% less than that has sadly been experienced in Britain. So I think that clearly, as an island, we've always said that there's an advantage in the fact that we are an island, and we have to use that to our advantage as we work our way through lifting restrictions whenever that period comes about. We have a memorandum of understanding now. I think that's going to really help us to guide us through the period that we have ahead of us. And it's important that we work together on the issues of modelling. It's important that we work together in terms of restrictions and what they look like across the island, and that we move together where we can to the advantage of the people that we look after.
Thanks, Tommy. Controversial question as ever from you. Let me say this to you. The comparison with the Republic of Ireland is a little bit more nuanced than perhaps some people have presented, because of course there are different data systems. And for example, deaths in the Republic of Ireland have to be reported within 3 months. Of course, you know, in Northern Ireland that's not the case. It's a much shorter period of time. So the reports don't just link up, but there's no doubt, given that we do live on an island, that there will be similarities, and that's why we need to share information and make sure that we continue to do that. And that's why we have the Memorandum of Understanding, and we will continue to share that information. But it's also true to say that we have greatly benefited from being part of the United Kingdom as well. We have gained in scientific ways, and of course we were told by our own scientific officer today that there are differential restrictions in different parts of some of the countries that are ahead of us in the curve. If you look at Germany or South Korea, for example, they have made differentials in particular parts of their country as to how quickly they come out. And that was the comment I was actually making over this week, that there may be different parts of the UK that move at different times. Doesn't mean that we disagree on a strategy. What it means actually is that we recognise that different parts of the country are at different stages, and actually, of course, population density has a big impact on all of this, and we know that London, I think Sir Patrick Vallance said yesterday, was about 2 to 3 weeks ahead of the rest of the country. And of course, they have a huge population density. I think it's nearly 5,000 people per square kilometre. When you come to Northern Ireland, that's 133 per square kilometre. And of course, if you move rurally into the west of the province, it goes down much further. So all of those issues need to be looked at in our modelling. We will continue to work with colleagues in the Republic of Ireland and, of course, with our colleagues in the other nations of the United Kingdom. Yep, he was coming back there.
He was getting great.
Sorry, I don't want to cut across Tommy there. It's
Yeah,
Michael McHugh here. Hello. I just in terms of the care homes, I wanted to ask that staffing levels are still being negotiated by the NHS unions, and as you First Minister said, the priority for testing is essential workers and people who are symptomatic. I mean, if you were in a care home, would you be justified in thinking that your concerns aren't being taken seriously enough?
No, I think, Michael, we are very much taking the concerns of those in care homes very seriously, and I know that Minister for Health has been in constant contact with the independent sector. I think he had a meeting with Pauline Shepherd on Wednesday of this week, who is the lead advocate in relation to that sector. It is about us listening and trying to put in place help for that sector, as well as, of course, not taking our eye off all of the other issues that we need to focus on. I am on record, very clearly on record, as saying those people who reside in our care homes are some of the most precious and vulnerable of society, and I would add to that those who work with them are very precious to us as well, because they do some outstanding work, not just in terms of healthcare, but in terms of mental well-being, in terms of keeping people in good spirits, and they are actually sometimes the surrogate families of those people in care homes. So I want to say to those people providing that care, thank you. And we will do all that we can to work with the sector to give them support.
And to add to that, let me speak directly to people who work in care homes who are valued. We are so grateful for the work that you are involved in right now. And, you know, this has been a very, very difficult time for everybody. And certainly staff have been very frightened. You know, they're not immune to the fear that people have out there in the wider community, probably even more so because they are working in care homes. So to all those staff, thank you so much for everything that you're doing. We will continue to work around the clock to make sure that you have everything that you need in terms of PPE, that the testing is continually ramped up to make sure you have access to all of that, and that we put that particular focus on our care homes to make sure we do everything that's required to protect both those residents of our care homes and those people that are so brilliantly looking after them right now.
Good afternoon, Alan Preston here from the Belfast Telegraph. Can you hear me okay?
Yes, Candida, go ahead.
I just have two quick questions for both the First and Deputy First Ministers. Firstly, your thoughts on the suggestion by the Northern Ireland Secretary that lockdown could be lifted on a county-by-county basis. And my second question is on Donald Trump and his comments that coronavirus could be treated by injecting disinfectant. I know the First Minister of Wales has already called this an extraordinary thing for a US president to say. So just your thoughts on those two issues.
Well, it is an extraordinary thing for a US president to say, and I'm certainly sure that it's not based on any medical advice, Alan, so I would concur with Mark Drakeford's comments in relation to that. It is important that we continue to take medical advice. Certainly, Michelle or I don't claim to be virologists at any time. We aren't experts in the field. Therefore, we are very much led by the advice that we are given, both locally and nationally. Your first question was in relation to lockdown.
If you want, Alan, just in terms of the lockdown piece, county by county, we're not in that space yet. We said that we'll review the regulations and we'll do that before the 9th of May. But we really, really must, again, take this opportunity today just to ask people, please stay at home and keep doing what you have been doing. This is the space that we're now in. We will not ask people to abide by these measures for 1 minute longer than necessary. But our whole approach to this is all about trying to bring down the curve, trying to stop people from dying. And if people don't adhere to that now, we are in danger of jeopardising the progress that we have made, and we're in danger of reversing the trend that we are now experiencing. So just, again, please, everyone, keep doing what you're doing, keep staying at home. And then whenever we get to the point where we're able to relax these measures, then that's what we'll do at the appropriate time.
Thanks, Alan. Thank you.